Hey guys, welcome back to my channel. It's your girl Michelle. In today's video, I'm gonna just be talking to you guys about a decision that I have made for myself. You guys obviously read the title, so you know what I'm gonna be talking about. This is a very sensitive topic for me. Feeling overwhelmed with a lot of emotions, good feelings, and also a bit of anxiety. If you're new, let me give you a backstory. A few months ago, I got diagnosed with something called adenomyosis, which is a overabundance of tissues that are in the uterine wall that causes a lot of pain, enormous amount of pain, debilitating pain, especially during ovulation and during your menstrual cycle. This is something I've been dealing with for a long time. I didn't know what was going on in my body. I just know that I was experiencing a lot of bleeding, severe pain, and it just was so many different side effects that became hard for me to focus on a day-to-day basis. So I went to go see my OBGYN for further testing, MRIs, blood work, everything, you name it, I got it done. And it came back that this is what my diagnosis was. My OBGYN also believes that I have endometriosis, but it's hard to diagnose that without actually going inside of me to determine where the endometriosis is. Endometriosis is a cousin of adenomyosis. They kind of go hand in hand. Only difference is endometriosis is on the outside of the uterus. So my doctor informed me that it basically goes hand in hand, being that it is inflammation. So I've been going through that and digestive issues, which has been hard for me to actually eat and gain weight. It's been really hard to adjust with that and having digestive issues as well. Your girl's been going through a lot of things, and I just had to look at the pros. I had to weigh out the pros and the cons about the situation. My doctor advised me that my situation can only get worse. It's not going to get better or go away on its own. And in order for me to get relief and to live a happier life, this procedure is totally necessary. The thought of me getting any type of operation brings a lot of anxiety to my mind, as it would anybody, because you're undergoing the knife as well as anesthesia. Of course, we have professionals who are trained to do this. There will always be room for you to think about the what ifs. That's something that I have been really trying to not think about. My mind is overthinking. There's many reasons why I feel the way I feel. Of course, surgery is something scary for anybody, whether it's getting your wisdom teeth out or getting stitches. You know, it's always going to bring you that fear of going to a hospital and stuff like that. But it's also going to be a life-changing experience for me. As women, we are blessed with these organs that allow us to become parents. You know, your uterus is where your baby grows in the womb. So this is something I had to realize and say to myself, knowing that after this procedure, I will not be able to have any more children. I am very grateful to have the 3 beautiful children that I do have. And as of now, I don't see myself having any more. But once the surgery is successful and it's done, it brings a little bit of sadness, because, you know, who knows what the future holds. I may not feel like that now, but maybe 3 years down the line, I may want to expand and have more children. So a little bit of sadness surfaces for me. But I also have to think about my health. I have to think about my health and longevity, and look at it in a positive way of how this surgery can be life-changing for me in a good way. I won't have to experience all of the pain. You know, I've been dealing with this for a long time, but I prayed and I gave it to God. He guided me, and he told me that this would be the best choice of action for myself. I'm scheduled to have a hysterectomy. I will be getting a partial hysterectomy, so my doctor will be removing my uterus and one of my fallopian tube, because I only have one fallopian tube due to an ectopic pregnancy. If you're interested, I have a video as well that you can check out. But he wanted to leave my ovaries, being that I am still young and it could cause, I'm at higher risk to develop other conditions if they are removed right now. So the good thing is that I'll still have my ovaries, and I'll still be able to, you know, I'll still be able to ovulate every month, being that my ovaries are okay. I don't have any problematic issues with my ovaries. I'm trying to prepare myself for this journey, even though, you know, my anxiety is trying to get the best of me. I know that if I believe that everything's going to be okay, it will be okay. I'm not going to spend too much time on the what ifs and what can go wrong. I'm just focusing on a new journey, a new start for me, so that I can feel better as a person, because we all go through different things in our body. And if you've been suffering with any type of condition, you know how stressful that can be. Not only does it hurt physically, but it can affect you emotionally, because it's so much pain. When you accumulate a lot of pain in your body, it will start to affect your mental health, because at the end of the day, we just want to feel good. You don't want to wake up every day with aches and pains to the point where you can't even do anything. You know, you're bed bound because this has been taking over your life. you know, it started to get really bad after I started to have children. Periods started to become more intense, the bleeding increased, and like the pain would literally sit me down to the point where I can't do anything. I can't do anything until this pain decides it wants to go away. The pain would be so bad, my uterus would literally swell to the point where my stomach looked like I was 3-4 months pregnant. I could press on my uterus and feel like a knot in the middle of my stomach. It would be crazy, and it seemed like no matter what I did, I couldn't get relief. I mean, I've tried everything and it was just there. You know, I would experience leg pain, rectal pain, cramping, back aches, everything, you know, even my hormones, you know, my moods, everything. It was just it's just too many symptoms that were affecting me. And you know, I feel like I'm in good hands. My doctor is a specialist in this. He has made me feel so comfortable, very thorough, and explained the process of how everything's gonna go, what to expect. I actually just picked up my medications that I have to take before the surgery. I'm just right now just trying to get everything ready for my surgery. I know I'll probably need a couple of days to recover. I want to let you guys know, if you don't see me uploading as much, then that's the reason. But I will like to take you guys on this journey, especially if you're somebody who is going through the same type of symptoms as me. I want to spread awareness to other people, what to expect, and take you through the whole journey and my whole process. You know, you never know what life is going to throw at you, but the good thing is that I'm glad I got a diagnosis. I feel like the worst thing for me is when you're feeling something in your body and you go to all these doctors and they don't find a diagnosis right away. They kind of rule it out to being like psychosomatic. It's in your head, you know, it's anxiety, it's stress, you know, but our body doesn't lie. And when you feel like there's something going wrong with your body or something's not functioning right, go to the doctor. Because had I not taken my health so serious, I would have never known that I was diagnosed with this. I would have just thought that, you know, I just have painful periods and that's just it. But this is a real disease. The only way I can get rid of adenomyosis, it's so hard to say that word, it's so hard. Adenomyosis is to actually get my uterus removed, to take the whole uterus out and get rid of it. It can be a little sad to say that my reproductive is going to be taken away from me, which is kind of like an attachment to my body. It's been in my body since I was born, you know, and so now it's not going to be there anymore. It's going to be life-changing for me, but in a good way. That's pretty much it. I will keep you guys updated. Surgery's in about a week and a half, so I'm just making sure to have everything situated in my house. I want to go out and get some comfortable clothes, making sure that my room is clean, making sure that everything is situated before I get the surgery. And right now I'm just taking the time out to really focus on having a clear mind. I want to make sure that I'm my best version of myself before I undergo the surgery. That way when I wake up, it won't be too much. I don't want to go to surgery feeling stressed out or having so many different things going on in my life, because it can slow down my healing process. And I already know I'm covered by the blood of Jesus and I'm going to bounce right back. I wanted to just update you guys on what's going on. I will be getting a partial hysterectomy. I'm asking if you guys can just say a prayer for me. Also, let me know if you've had a hysterectomy and how you felt afterwards. Again, this is something that's new for me, so I don't know really what to expect. I'm just hoping for the best. Hope you guys enjoyed this video. If you did, give it a thumbs up. Make sure you subscribe. Stay tuned. Make sure your bells are on, because I will probably do a series of everything in my progress. I want you guys to be here every step of the way. I love you guys so much, and I'll see you guys in another video.